Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Dietles crisis. So what is Dietles crisis? Dietles crisis is nothing but it is also called as intermittent hydronephrosis. It is Dietles crisis, or we can also call it as intermittent hydronephrosis. What is this? Actually, a swelling is present in the loin. In the loin, a swelling is present along with acute renal pain. Okay, and after some hours later, the pain will be relieved. Okay, due to some reason, whatever the reason is, the pain will be relieved. After pain is relieved, the patient will pass large amount of urine. Okay, actually after some hours later he has urge to pass the urine, so patient will pass large amount of urine. Once the patient passes large amount of urine, the pain that he experienced is relieved and the swelling will also disappear. So this is called as Dietles crisis. Why? Because actually the swelling, first there is a stone, this is the kidney, and there is a stone which has obstructed here. So because of this obstruction, the kidney has been swollen, resulting in hydronephrosis. Okay, the renal pelvis is so swollen or filled with urine. Okay, after some hours later, due to some reason, this stone is comes out, this stone will come out. So when the stone comes out, it is, there is no stone now. So suddenly this pressure here is relieved, this obstruction is relieved, so all the urine will come out. So the patient will pass large amount of urine, and the pain and swelling which occurred due to hydronephrosis is now relieved. So the pain is relieved, even the swelling is relieved. So this is called as Dietles crisis or intermittent hydronephrosis.
thank you and thank you for watching.